Right. Hello, everyone. Welcome to the Reimagining Prevention webinar brought to you by the Office of Child Abuse Prevention's Strategies TA and CalTrin, the California Training Institute. Today's webinar is the first of the Reimagining Prevention series, and we are so honored to be joined today by Junious Williams, a principal consultant from Collective Impact at the Aspen Institute and Junious Williams Consulting. So we know this is a little bit new to you. We're using a webinar format today. So unfortunately, there is no camera or microphone to choose here. We are able to, assist you if you need through chat. If you have questions for Junius, we will have a question and answer time. But if you wanted to, put any questions for our presenters, please do so in the Q&A icon, and you'll see that it looks similar to the chat, but it actually has two sort of little, looks like pieces of paper there. So go ahead and please feel free to use that if you have questions. So we wanted to just do a check-in and just please in the chat, I know some of you have already started to do that, so thank you so much. But please feel free to share your name and the county or partner that you work with. And also we are going to do a land acknowledgement. And so this is a link that we will be sharing with you in the chat. And you can see what native land that you are joining us from. I'm joining you today from the Tongva native land. So I want to go ahead and pass this to Hillary Conrad, who is the new bureau chief for the Office of Child Abuse Prevention. Congratulations, Hillary. She's been a champion for prevention, and we're really excited to hear her message.
Okay, thank you, Lydia. Good afternoon, and welcome to the launch of the Reimagining Prevention webinar series. I'm grateful to be partnering with all of you to serve children and families, and look forward to listening and learning with you during this webinar. Before I begin, I'd like to acknowledge that I'm coming to you from the native lands of the Nisenan and Miwok tribes, currently known as Sacramento. I also want to thank Strategies TA, CalTrin, the prevention champions you will hear from, and our keynote speaker, Junious Williams, for collaborating to develop and present this webinar today. It would not have been possible without all of us working together. Imagine if we could mitigate trauma and provide services to families without any system involvement. Imagine if children could remain in their homes and still be provided adequate supports and resources to thrive. Imagine if coordinated approaches were not only focused on children in the system, but those prior to the system. The Office of Child Abuse Prevention has a vision to create an integrated statewide system to reach families sooner, to build strong local prevention networks and a statewide prevention network, and to strengthen not only families, but communities. We strive to make it happen by building capacity of community partners, joining with others around a common goal of child and family well-being, and starting to look at the larger landscape of services being offered across public and private agencies. We have to start thinking of a long-term vision for social change that is sustainable. We have to reimagine the way we are committing, coordinating, and investing in prevention work. Oh, I think we're off by a slide or two. Okay, you're good. Stay right there. For the first time, federal legislation has provided state agencies the opportunity to leverage Title IV funds to shift to an upstream approach to serve children and families, and to start thinking differently about when and how we engage with families and the quality of services we are delivering. At the state level, we are currently planning for the implementation of the Family First Prevention Services Act Part 1, which is federal legislation that states can choose to opt into to deliver evidence-based services to individuals that are at imminent risk of entering into foster care. These services will be provided to families that are involved with child welfare and probation, but will keep the families intact and the children at home. California wanted to build upon the opportunity of this legislation and moved even more upstream as part of the plan. We included a community pathway, which we envision as a way to increase social connections and have a community culturally responsive system that is grounded in the engagement and identified needs of communities that we are serving. Next slide. California continued to expand upon the legislation by enacting Assembly Bill 153, which builds upon the Family First Prevention Services Act by offering additional funding, and that requires counties and their partners to develop a comprehensive plan that includes primary, secondary, and tertiary strategies. Development of the comprehensive plan will require collaboration with community providers, other public agencies, tribes, individuals with lived expertise, and other key partners. The state has realized that our government agencies and community partners may have varying levels of understanding of what is primary prevention and what it will entail to develop a comprehensive plan utilizing a cross-sector approach. This webinar today and the others in the series will be a primer and a way for community partners and county agencies to start thinking about how their agency may fit into the larger goal of developing a comprehensive plan. Next slide, please. In the last several years, prevention has been elevated as a way to change systems and impact children and families. Opportunities of funding from the federal government have been centered on collective impact approaches and primary prevention efforts. We are making a concerted effort in California to elevate investments in primary prevention strategies to ensure every Californian, whenever in need, has access to supports. We have focused our attention on children and families when they touch the system, but we are looking towards the future, and the future requires strategies that uplift all people, and the comprehensive plan sets this in motion. Primary prevention is the first step within a continuum of services, and this strategy, which is outlined in the comprehensive plan, is key to reform and reimagining a system that supports prevention and early intervention. Next slide, please. To accomplish the vision of an integrated statewide system that supports families to provide safe, stable, nurturing relationships and environments for children, the comprehensive planning process includes the following elements: strategic planning instead of a deficit-based approach, analyze data to make informed decisions on populations to prioritize and strategies to develop, a table of key prevention partners, including tribal representation and individuals of lived expertise, community engagement and assessing system and provider capacity, and to determine what pre-work you need to complete before developing the comprehensive plan. Next slide, please. We must do things differently to get better results. This comprehensive planning process will result in the breaking down of silos, cross-collaborating between systems, and creating culturally responsive programs and policies specific to prevention. We must do things differently to create healthy, thriving communities with equitable supports for all families. Upstream approaches are critical to redesign the way families are supported before crisis occurs. Services alone are not enough. We have to start thinking of improving our communities as a whole. To improve our communities, we can move towards improving the social determinants of health, the conditions in which we all live and work and play, to truly impact children and families' lives, to mitigate trauma and address the root causes. Next slide, please. Today, we will hear ways to start to reimagine how we can create these healthy, thriving communities that we are envisioning. This webinar will begin to move us towards a common goal of investing in upstream approaches. I invite you today to rethink how we can do our work differently and collectively, to hear from prevention champions from different agencies and collaboratives who have already started this work, explore a prevention mindset, learn how to start with collective impact, community engagement, and equity as the foundation for reimagining prevention, and finally, what's to come in the series ahead. Next slide, please. Lastly, I want to thank all of you for your continued work to serve children and families and for being here today. We know that so many of you have championed prevention efforts in every part of the state, and we are grateful for all of your commitment, passion, and drive to keep children and families healthy and safe, especially through a global pandemic. We want to acknowledge the amazing work you have done and look toward the possibilities of what is yet to come. Today is just the beginning of the exploration of what a prevention mindset means for California. And with that, I look forward to learning along with you today, and I will pass it to Sarah, who will introduce our prevention champions. Thank you.
Great. Thanks, Hillary, so much for that welcome and framing. Much appreciated. And welcome, everyone. I just am so touched, and it's so incredible that we have nearly 500 people on today to learn more about how to do this work more equitably and with community in mind and at the table with us. So I'm Sarah Lockroy. I'm Director for Strategies TA with the Children's Bureau of Southern California, and we are a proud partner with the Child Abuse Prevention Center for the Strategies TA program. So as Hillary mentioned, given the importance of prevention for families, children, and communities, we wanted to bring the voice of other prevention champions into this space today. They're going to share a little bit about their work and how they are advancing community voice and equity in the field right now. So that said, I'm not going to delay that process any longer, but I would first like to introduce Ebony Chambers from the Peer Backbone Committee. Ebony, take it away.
Hi, good afternoon, everyone. Such a pleasure to be here and share this space as we talk about reimagining prevention with all of you. My name is Ebony, and I am with Stanford Sierra Youth and Families, and I am representing the Peer Backbone Committee, and that is the network that I'm a part of. It's with California Department of Social Services. And so we advance equity by ensuring that those most impacted by systems are a part of the transformation, and their voices are not just heard, but really elevated and a part of leading the change. And so that's what gets me really excited about the work. We're excited to join this effort to reimagine prevention because we know it benefits our community by creating more interconnectedness and understanding when we're all working together. So thank you for having me here.
Yeah, absolutely, Ebony. Thank you for being here. So next I have with us, and I hope I can't quite see, but Ron Brown, representing the California Family Resource Association, CFRA. Ron, are you here with us? I can't quite see. So I'm going to go ahead and move to our next person, and we'll circle back to hopefully hear from Ron as well. So now I'd like to introduce Kathy Eisenhower with the Prevention and Early Intervention Committee.
Good afternoon, everyone. And like Ebony, I'm excited to be here. And thank you, Hillary, for those inspiring remarks to get us started today. I am the co-chair of the Prevention and Early Intervention Committee of the State's Child Welfare Council. And I am excited to welcome you along with my co-chair, David Swanson Hollingworth, who managed to stay off camera, to join us in our partnership with CDSS to bring California's vision of prevention to fruition. The PEI committee really strives to advance equity and lived expertise by ensuring that our membership, as well as all the work that we do, is reflective of and informed by the voices of the diverse populations in California, along with the voices of the youth, parents, and others who've been impacted by the systems that we're really seeking to change. We believe that by joining together with all of you in this effort, we will help our committee to reaffirm our visions and beliefs and ensure that our work continues to embrace diversity and equity, supports the development of meaningful collaborations, and the empowerment of communities as we move towards reimagining prevention and really working to build the child and family well-being system throughout California. So thank you again for inviting me today and looking forward to this work. Thank you.
Kathy, thanks so much. So next we'll hear from Jennifer Parsons with the Office of Tribal Affairs. Oh, we may have lost her. Jennifer, are you here with us? I know she had some internet issues today. Okay, I'll move forward and hopefully we can circle back to Jennifer as well. So from the Office of Probation, I have Jim Emerald with us. And Jim, I hope I'm pronouncing your name right.
Yes, thank you. My name is Jim Amaral. I'm a supervising deputy probation officer in Nevada County, small rural county up north of Sacramento area. I'm really excited to be here today. I think normally speaking, probation isn't a term used in prevention in the community. However, with the implementation of Assembly Bill 2083 and the Children's System of Care, I think it's extremely important to understand that probation's job in the state has drastically changed from this punitive approach to a more restorative justice approach. And that restorative justice piece cannot be done by ourselves. There are so many partners in our communities that we can use to swim further upstream, as I think you guys have talked about that many times over thus far in the first 20 minutes. And our goal really is to try to swim as far upstream as possible to minimize the entry of juveniles into the justice system, because juveniles that enter the justice system generally as a result of an unmet need. Something that happened at home is an unmet need. So as our children's system of care, I think it's really important to understand that our goal is to treat, I should say, normally speaking, counties treat families in silos. Oh, they're a probation family, they're a child welfare family, they're a mental health family. I challenge you to approach it as they are our family, our county's family, everybody in the county, all county agencies, preventative and otherwise, they're our family. And how can we as a collective group create systems for not only treating the families that are in our system, but also prevent others from getting in. So I appreciate the invitation and hope that you guys look to partner with probation in your counties moving forward. So thank you.
Thanks, Jim. Absolutely. Yes, incredibly important to have that partnership. Thank you. So Jennifer, I'm gonna hope that this will work for you. Can you hear me and are you able to talk?
Yes, I switched from my phone back to my laptop. Thank you for circling back. I'm very excited about the participation, the level of participation in this prevention webinar. We're very excited about this work and FFPSA. I just want to say good afternoon. I'm Jennifer Parsons with the Department of Social Services and the Office of Tribal Affairs. I'm a member of the Pawnee tribe, and I come to you from the traditional lands of the Nisenan people and Miwok tribes. We, in the Office of Tribal Affairs, advance equity in numerous ways. First of all, the Office of Tribal Affairs is housed within the department's Office of Equity, which is a recent reorganization in the last couple of years. CDSS initiated the Office of Tribal Affairs to advise leadership to build better relationships with tribes and coordinate the integration of tribal considerations throughout the department. The CDSS established the Office of Tribal Affairs in 2017 in recognition of the department's need to integrate and institutionalize tribal activity throughout the department. The OTA works to cultivate informed participation and trusting relationships with and among tribes, CDSS, and counties to enhance the well-being of American Indian children and families. Our work is grounded in meaningful tribal consultation and engagement of core stakeholders in our work to advise leadership. The OTA guides CDSS's efforts to help create and facilitate policies, procedures, and programs that serve American Indian children and families by engaging with tribes and counties, enhancing efficiencies and the responsiveness of CDSS's work with tribes, and advising and facilitating technical expertise on the Indian Child Welfare Act and tribal affairs. We are very excited to to join this effort to reimagine prevention because it benefits our tribal communities in numerous ways. For one, tribes are committed to prevention efforts, and it's the standard way that services are provided with that strength-based and prevention framework is deeply ingrained in the way that the services within tribal communities are delivered. And we are supporting this through our authentic tribal consultation and engagement. The state and counties will be able to design legislation, policy, and programs that support the Indian Child Welfare Act, which is considered the gold standard of child welfare. One of the major tenets of ICWA is active efforts to prevent the breakup of the Indian family. By improving consistent statewide implementation of the Indian Child Welfare Act, we will improve outcomes for all children and families that come to the attention of the child welfare system. Thank you.
Jennifer, great. Thank you so much. Glad we were able to hear from you. And last but not least, I'd like to introduce Michael Williams from the California Family Resource Association. Michael, take it away.
Sure, thanks, Sarah. With a little Zoom magic, now I'm with CFRA. Unfortunately, Ron Brown couldn't make it. I'm Michael Williams. I'm the Policy Director at the Child Abuse Prevention Center. We are the staff support organization for the California Family Resource Association. And CFRA is a membership organization of family resource centers, family strengthening organizations, and family strengthening networks around California. And FRCs are, and the organizations we represent, as so many organizations you all represent, and many of you are among CFRA members, are integral to the community and therefore really help us keep our focus on community voice. They are an amazing vehicle for community voice and for promoting equity in every community where they serve in California. Ron Brown, along with Katie Albright from Safe and Sound, are our policy committee chairs, and we have a number of member leaders also on the webinar today. And so we're very excited to be part of this. We're very excited that family resource centers have been part of prevention planning in most of the counties that we work with, and that OCAP has made family resource centers such a priority, because I think that's going to be a real critical link in elevating community voice and promoting equity.
Michael, thank you so much. And I had one more. I apologize, Antoinette. Last, but of course, very not least, I'd like to introduce Antoinette Manuel, and I hope I'm saying your name right, with Essentials for Childhood.
Yes, thank you. Thank you so much for having me. I'm Antoinette Manuel with Kids First Child Abuse Prevention Council in Placer County. And here today representing Essentials for Childhood Coalition as their co-chair, along with Dr. Danielle Prince. Essentials for Childhood is a project of the California Department of Public Health Injury and Prevention Branch and the California Department of Social Services Office of Child Abuse Prevention. The initiative advances equity through collaborative efforts that improve child well-being through policy and social norms change, utilizing data to inform action. We're excited to join in this effort to reimagine prevention because our collective work can advance and support efforts to achieve our vision that all California children, youth, and families thrive in safe, stable, nurturing relationships and communities where they live, work, and play. So thanks again for having me.
Great, thank you so much, Antoinette. And so now I believe that is all of our partners. I am going to have the pleasure of introducing Lola Cornish, who is our new senior program manager and my co-lead with Strategies TA. So Lola, nice to see you. Take it away.
Thanks. I just wanted to give a little bit of update for those of you who might not be as familiar with Strategies Technical Assistance, talk a little bit about what we do. Next slide, please. So this is our vision. We want united communities, strong families, thriving children. And our mission is there as well. we support and inspire cross-sector networks throughout California to advance community-given action to strengthen children and families centered in equity and inclusion. And then the five icons that you see there are our values that we hold dear. So equity, always a strength-based focus, collaboration, that's true collaboration, involving the community voice and those of voices of those with lived experience or groups that are typically left out. And finally, accountability. Next slide. So in addition to supporting county prevention planning teams in their primary prevention planning through our technical assistance consulting, we also host webinars like this and learning exchanges that are held on topics that are relevant to the field. Our next learning exchange is on the 22nd, and it's for rural communities, and it's going to be focused on tribal engagement. And then we also have larger team gatherings. So we have regional meetings, statewide convenings, things of that nature, again, with the goal of supporting the counties to develop those prevention plans. And now I believe it's my turn to introduce someone fabulous. So Michael Williams, take it away.
I think I've been here before. So what I am doing in this part of the conversation is describing a little bit of our experience, especially in the last year, supporting counties on the collaborative child abuse prevention planning and our conversations, even in getting ready for this webinar on what it means to have a prevention mindset. So this comes out of our conversations as well as ways that we've been involved in the community. So if we go to the next slide. So last year, Strategies hosted 2 events. One was our statewide convening of prevention planning counties. And that's where we first heard Junious Williams and were challenged by what we're going to be challenged by even more deeply today, that call for greater equity, which includes addressing disproportionality of impact in child welfare and genuine community voice. The other thing that informed our conversations and our actions in this last year was a webinar that came shortly after that with best-selling author Dan Heath, who wrote the book Upstream. And here are some of the things that challenged us. Just a couple grab quotes that we used in promoting that webinar, but they were part of that discussion and were infused in our discussions in various degrees with all of the counties we work with as a real challenge about where do we go with this. So one is presenting the problems. Surely we'd all prefer to live in the upstream world where problems are prevented rather than reacted to. What holds us back? Click next. Part of what he says is that the tragedy of so much of the social service sector is that leaders tacitly accept the flawed system that begets their work. So why have we not done prevention? Why do we continue to have the problems that we're trying to ameliorate? Next click. One reason why we tend to have to favor reactions, because it's more tangible. Downstream work is easier to see, easier to measure. Next click. Upstream work is about reducing the probability that problems will happen. And for that reason, the work must culminate in systems change, which is much more complex and a lot of work. But, oh, go ahead and click. But this is the vision, and this is part of the vision that Hillary challenged us with. What the world needs now is a quieter breed of hero, one fighting for a world in which rescues are no longer required. So, as I said, these the challenges of last year, there were conversations not around tables, I suppose, around Zoom screens in various counties about how do we put these in action. And that was part of the inspiration for this webinar and webinar series. Also, California, through OCAP, participated in the Prevention Mindset Institute. And that got us thinking, actually, is this slide might be out of order. Do we have the one on the prevention? Oh, this it is, thank you. that got us some of the principles that came out of the Prevention Mindset Institute in our conversations and setting this up, help frame what it is we're talking about when we're talking about a prevention mindset. They frame it as ambitious goals designed to create a more prevention-focused and equitable environment to support child and family well-being, and actions to partner with communities, identify critical stakeholders, address policy and structural changes, and track progress towards successful outcomes. So you can kind of hear how that responds to Dan Heath's challenge. So we as a committee said, well, if we're going to do a webinar on prevention mindset, we need to define it. But that's kind of part of doing the webinar, and part of exploring, part of your definition comes in action. And so instead of saying, here's the definitive last statement on the prevention mindset, what we've been able to tease out are some assumptions. And so now we'll go to the next slide. So here are some assumptions. So with a click, and you can kind of click after I read each one to bring up the next one, as we've been able to frame them so far. So this is open to discussion and dialogue. You can send notes in the chat or Q&A if you want clarity on this. But here's some of the assumptions that we've been able to articulate. That it involves accepting the collective challenge to truly reduce child abuse and neglect and increase child, family, and well-being. It involves changing community conditions and building on community strengths, as well as improving services. So about the conditions, not just the services. Enacting change through shared vision. Centering our goals and work in equity, for that not just to be an afterthought, but really the center. Making community voice and partnership the drivers of change. Again, not just a token participation. And seeing that everyone has a role, nobody holds the whole solution. We might have one more or two more. Looking beyond current funding silos that are focused downstream. And determining definitions of need and measures of progress using data on disparities and inequities. And then I get to do the next introduction of Junious Williams, the Senior Advisor for Collective Impact at the Aspen Institute and a principal in his own consulting. His work, you can find it in Stanford Social Innovation Review, and I think we'll have some connection to that, as well as the Collective Impact Forum and FSG. He's part of the ongoing dialogue around collective impact. And I got to be engaged in a webinar he did for the Department of Justice Child Safety Forward project, and that Sacramento is part of last year. And Junius, then we invited Junius to be a keynote for our statewide summit for county prevention planning teams. And the themes he's speaking to, digging into deeper today, he spoke to then, and people really wanted more. How do we really center the work in equity? How do we make community voice something genuine? And so we're all really looking forward. I don't want to take up any more time away from Junius's time. After he does some introductory content, Hillary and I get to do some follow-up Q&A with him to draw out even more examples. But I will hand it off to Junius at this point.
Excuse me. Thank you, Michael. And thank you, all the members of the planning team, and also to the participants for joining us today. A couple just issues to set the stage. We're going to do this segment of the agenda in three parts. The first part, I'm just going to present some frameworks around collaboration, around equity, and around community and family engagement, and then make a couple of comments about prevention. Then, as Michael just indicated, we're going to do a moderated Q&A for the second part of the agenda. And then finally, the last segment of the agenda will open it up for any questions that participants have, or comments. It doesn't have to be just questions. So that's where we're going. And next slide, please. In addition to those three main segments, I also have a few resource slides, and there's a contact slide with my contact information as well. And so there are a lot more slides in each segment. I'm typically going to focus on one or two. And let me say something about frameworks. I like to use frameworks because they're a way of organizing conversation and discussion. And you don't have to agree with everything that's in the framework, but at least gives us a basis for discussion, argument, what's missing from it. And that's why I think they're really useful and powerful tools. And I'm going to present parts of three different frameworks to you today. And I'm going to spend roughly 5 minutes on each of them. And then, as I said, I'm going to open up and make a few comments about prevention. Next slide, please. Next slide. So the first thing I want you to know is I'm a practitioner of collective impact as an approach or model. My co-authors and colleagues don't like to call it a model because they think it implies something that we don't intend to say with respect to how we approach collective impact. But the point is, there are a lot of different ways to collaborate, and you have this chart in your materials. Let me pause for a quick second. My slide deck is available in a PowerPoint, and somebody should be providing you the link where you can obtain it. Sorry, I forgot to mention that. A lot of different ways to do collaboration. I like this particular approach and invest my time in collective impact because after having done collaborative work for the past 30 years, this model was really responsive in a way of organizing and understanding what we were doing in a lot of the work. So you have this as well as a link to it, but recognize I'm going to focus on one particular approach or model. There are a lot out there, so if something in this isn't striking you, please go back and look at some of the other tools. Next slide. Let me say something about the collaboration. Why are people collaborating, and why is it such a big issue? And it's a very simple reason, that we cannot solve complex social problems in a siloed way. We learn that, and all should be well aware of that, as we saw what happened during the COVID pandemic. All of these social issues that we struggle with are interrelated and interconnected, and it took something like the pandemic to expose most of us to the interconnectedness. It's like you can start on one issue, but the issue is likely to be connected to 2 or 3 other issues, and you can make some progress on that one in isolation, but you can't solve holistically. So we're responding in this society, and in fact around the world, to a recognition that these complex social problems cannot be solved by a single organization, be it government, be it business, be it community, be it philanthropy. So we need to find ways of working together to solve these problems. Now, collective impact came about 10 years ago. It was published in an article in the Stanford Social Innovation Review. And for 10 years, many people used it, but a lot of people struggled with it. So upon the 10-year anniversary, the original authors, John Kanya and John Kramer, or Mark Kramer, joined with a bunch of us, some of whom were colleagues, some of whom were critics, to see what can we say about the maturing of the collective impact approach over the last decade. And the first thing we did was we changed the definition, and I'm not going to show you the old one, but I'm going to highlight really quickly. This is about networking and connecting with people. That collaborative work is essentially about that. And whether they're organizations, individuals, or institutions, the thing that is most fundamental in the change that we made is that the first iteration of the collective impact approach did not mention equity at all. It did not mention power at all. It did not mention community engagement. So as we tried to reformulate the concept in the 10th anniversary, we tried to make sure that all of those elements are prominent in the definition and in the structure that we're offering people, the remodeled framework, as we're calling it, Collective Impact 2.0. It's about advancing equity. The social problems that are somewhat intractable in American society cannot be solved without addressing the equity issues, because most of them have their origin in equitable, discriminatory treatment of various populations, be they on the basis of race, on the basis of ethnicity, culture, gender, one's ability status, one's age, one's income. We have wreaked havoc upon the lives of people in this society by making decisions and policy and practice to treat people differently. And as a result of it, you can't solve these problems without addressing the fact that they have their origins in our mistreatment of people and the discriminatory pattern. So you got to go and correct that. It's also, though, and we wanted to highlight in the new definition, this is about learning together. When we talk about the data isn't for got you, it's knowing how are we progressing or not progressing, and what do the data suggest to us that we might want to change or adapt to be more effective. This collective impact and other collaboration should be about collective learning. It should be about aligning what we're doing and seeing how our work connects and integrates with the work that everybody else is doing within their community around two outcomes: population level change. And when we say population level change, we're not talking about the 100 kids in my mentorship program. We're talking about the 10 or 15,000 kids in a county who need that same sort of intervention and service. We got to move out of the programmatic to the population level. And secondly, we know it's about systems change as a tool for effectuating improved outcomes. So that's the basic definition. Let me show you the framework really quickly. Next slide. 5 conditions or elements in this particular framework. The first is a common agenda. A lot of times when we're working historically in collaboratives, we came to collaborative tables because something that was an organizational imperative we thought could be solved or addressed through our participation in a collaborative. What happens in collective impact is you may still have that agenda, but that's not what brings us together and drives the work. What drives the work is a common definition, understanding of a problem, and a shared vision about what the change is. So we're all subscribed to that. Now, I still may have an organizational imperative that it'll move, but it's not about me and my organization. It's about what we've agreed to collectively. Secondly, there's shared measurement. We're all on the same page about what the outcome measures are. We're collecting data and measuring the results, so that there might be 10 programs doing that, but the first thing we want to do is get everybody who's doing that program or intervention or strategy to aggregate their data so we get a picture around figuring out how we're really impacting the broader community. As I mentioned before, it's also about continuous learning and improvement, which is we're doing the data not to get you and punish you or make fun of somebody who isn't performing well. This is about learning and about getting in a cycle of continuous improvement by applying our learning and knowledge to program improvement. It's also about shared accountability. If we're all at the table and things don't happen the way they should, it ain't about the program implementer. It's about everybody around that table. We collectively share accountability for success or for failure. Let me say something else. Failure, this notion about making mistakes and failure, we got to relax a little. You know, this is cutting edge work that a lot of you are doing, and you're going to make mistakes. One of my old mentors used to say this to me, and it stuck with me my whole life. He said, "Don't worry about my funding. As long as you're making new mistakes, you're okay with me. And that's really powerful. If we're learning, we don't make the same mistakes over and we're extending our way. Let me jump into the third one. Mutually reinforcing activities, that there are a lot of strategies and approaches and activities and programs and services and policies and systems change that we want to bring together to really impact and improve outcomes. And they need to be mutually reinforcing. We need to understand how various activities that people are undertaking align with the basic strategies. The second thing is, when we're doing that, we need to harden our resolve to make sure that we are making investments in things that work. And when things don't work, we're either working with the providers or whoever's doing that service or policy or systems work to get them to improve or to stop funding them. And that's a hard decision. But if it ain't working, we need to stop doing it. These are the most vulnerable communities that we're trying to serve who have these horrible outcomes. And it's inexcusable that we would continue to invest in things that don't help to improve outcomes for them. The fourth element is continuous communication. You're building some sort of collaborative structure. You're bringing people together. You're forming committees and subcommittees and work groups. You have to have an effective system of communicating, of people finding documents and of being able to understand what's going on. But it's also about communicating with the broader community, because effective collaborations are going to discover solutions to problems. And at that point, you want to be able to go to the community and say, we got the evidence, this works. Let's have the scale conversation, scaling it up so it's no longer these 500 or 1,000 kids. We're looking at the 15 or 20,000 young people that we know need a particular intervention. And then finally, and this is one of the most important elements of this approach, dedicated staff. Historically, what we've done with collaboration is we brought people together, funders didn't put any money on the table, and it came out of the hides of people at the table. And all of us know that there's some things that need to happen. So part of what we're doing is, in this particular approach, is saying, no, fundraise and have a dedicated staff, and then have the participants in the collaborative apply all of their creative energies, not to doing administrative functions, but the creativity to find the right analysis and solutions to the problem. So having a dedicated staff that's running meetings and planning and taking notes and doing research and helping to raise money and all the other things that are necessary for a collaborative to be effective. That's the basic framework for collective impact. Common agenda, shared measurement, mutually reinforcing activities, continuous communication, and backbone support, and see the big lettering at the bottom. It ain't a model, and so you need to bring to bear your wisdom and expertise and local knowledge to say, that ain't gonna work like that in my community. You gotta do that. No model or framework can be plucked down in these diversely different communities and expected to work. So bring to bear your knowledge, wisdom, and expertise to say, no, we aren't going to do it that way, or we can't do that right now. Next slide. I'm going to run through several slides really quickly. Would you click on that one? It's one of the animated slides. I forgot to take the animation off. I think there's another couple clicks on it. Yeah, I think a couple more. Yeah. Okay, so I do this one really quickly to show you, when you're forming collaboratives and when you're starting to have a conversation about power, about engagement, this is the context in which that's going to happen. Who sits on steering committee? Who's part of the backbone? What are the work groups, and how diverse and inclusive are they of various interests? So this is where a lot of that stuff gets played out in the infrastructure that you erect for your collective impact or whatever collaborative work. Next slide. I'm just going to hit these really quickly to let you know what's here. I'll talk a little bit more about power or about systems change. If you haven't seen this, this is from an article, The Waters of Systems Change, and it's another framework for being able to have a discussion of what are we talking about and what are the elements or conditions for systems change. Please take a look at that because the article is really informative. And again, it gives us a way to talk about it. I disagree with my colleagues about that transformative change, but at least they framed it so that we can have the argument and discussion and figure out how to move forward. Okay, next slide, please. I'm going to skip through this. These are different approaches or strategies for doing systems change. One really quick point. A lot of people doing models say it's all got to be about systems change. Don't do programs and services. That is a mistake. You need to do both. And you'll see in a moment how we're approaching that in the article. Because the systems change is long-term. But systems change originates from the fact that people are experiencing disparities. Disparities means that people have been harmed, right? And so you're not going to wait long term to start repairing some of the harm. So having programs and services right now, you're ameliorating, mediating, intervening to try to reduce the amount of harm that discriminatory practices are having while you're trying to get your policy, systemic and structural long-term work done. Next slide, please. Okay. Really quick, I'm sorry it was that quick, but that's basic framework for collective impact, and some of the planning team has much longer decks from me if you want information. Next place to go is equity. And in the article that we're mentioning in the December Centering Equity article in the Stanford Social Innovation Review, we define equity there, and you see equity from the Centering Equity definition. There's also policy links definition, and then finally there's mine. I like mine because I want to emphasize that this is about eliminating the disparities, that we are not going to get to equality, and I'm willing to declare that we've reached equality as long as people are experiencing disparity. So I want to eliminate the disparities among people so that we can achieve the equality that is called for in the Constitution. So that's my focus. And I'll make a broader point a little later when we get into the 5 equity strategies. Next slide. And I apologize for this slide. It's not very artful and it looks too much like the 5 conditions or elements of social impact. But very quickly, let me lay out what we lay out in the article. We think there are 5 primary strategies that need to be employed to center equity when you're doing collective impact, but really any kind of collaborative work. The first thing is you've got to ground the work in shared language. One of the difficulties in America is that we have never been able to have clear, hard conversations about issues of disparity, be they on the basis of race or gender or ethnicity or whatever the social characteristic is. So one of the first things folks need to do is that you need to develop a glossary, a whole shared language so that you can have a conversation. That's part of grounding the work. Secondly, the work's got to be grounded in data and context, and the data is around disaggregating the data. Who are the segments of the population in our community who may be experiencing disparity? What does it look like in terms of people who live in rural areas, in suburban areas, or in urban areas within our county? Are there disparate outcomes for them? I'm working right now in a jurisdiction in Ohio, and you go out and you look at the data in the rural communities in this county, and you've got all sort of disparities because of the opiate epidemic among white males. But the urban center around there has a problem with over-incarceration of black males. So again, you've got to ground the work in data. You need to know who the community is, and you need to run the data analysis to be able to say, here are groups that bear further inquiry because we think they're experiencing disparities. On the context side, and this is a hard one right now, given what's happening politically around the reaction to critical race theory, but I'm going to say it anyway, which is we live in different realities in America. And for too long, the white reality has dominated policy making when, in large measure, those who were doing the policy making had no idea of what was happening and how those things looked on the ground in Black and brown communities, among women, among LGBTQ people, whatever the population is. We need to delve into that to understand, how is it that these patterns got produced? What's the context for this? And that's where the battle is going on right now about not teaching history to white kids, which is appalling, right? It's absolutely appalling. I'm going to try to stay around the political issues, but we ain't going to make no progress on anything if we don't tell ourselves the truth about America, right? There are some things that are unimaginably great about what's happening over the history of this country, and there's some things that are absolutely shameful and abhorrent. And if we can't elevate the good things and recognize and address the bad things, we ain't never going to correct. That's the context, and that leads to the final point I want to make. Since we visited misery and discrimination on specific populations, you can't step back and say every solution is going to be universal, because we've embedded into the system discriminatory practices and outcomes, which mean that's a decision that we're just going to perpetuate the disparities. You have to target. If you look at the data and Latino males are overrepresented among those who are being suspended, and we try to figure out what to do, we need to focus on Latino males. We can't come up with a universal solution, because oftentimes universal solutions actually exacerbate the disparities. So one strategy, you got to ground the work in a shared language, you got to ground the work in data and context, and you got to be able to target the solutions to the populations that are experiencing disparities. Second, focus on systems change. I've already mentioned this a little bit. It's both and, it's not either or. Good programs and services give rise to an understanding of policy and systems needs. Good policy and system give rise to programmatic and service needs. It is bi-directional, it's not one-directional. So I want all of those things operating. And as I said before, I'm going to build relationships with communities that are experiencing disparities by saying, no, there are going to be some programs and services within our means that we're going to get to people right now to try to relieve the immediate pain. Third, you got to shift and share power. You got to understand what power is in these sort of tables, in the collaborative and in the communities that you're operating on, and you have to very deliberately shift and share power. Those who have traditionally had all the authority and the power and the resources need to step back and relax and start working with some other people who bring different life experience, lived expertise, perspectives on the problem and perspectives on solutions, and they've got to have a place at the decision-making table. So when you're creating the collaborative and you're thinking about who's going to be there, you got to think about, it's not sufficient just to bring a token here or there. You've got to think about, how do you shift the power and culture within those groups? And part of what we also need to do is we got to recognize that there are all sorts of assets in the communities. And while we may not see it from our vantage point, people have found solutions to some of these same problems, but nobody gave them any money or asked them what the hell they thought about it, so they're operating in isolation. A basic tenet is we've got to start listening to and acting with community, honoring what they've already figured out are solutions and supporting that, rather than coming in and saying, we got all the answers and this is what we're going to do. And finally, there's got to be accountable leadership. One of the problems in all of this, ain't nobody accountable for producing better outcomes around equity. We ain't rewarding good service and performance, and we ain't punishing or remediating or correcting bad behavior, which means that we've got to build in both leadership and accountability into the structure. So those are the 5 basic strategies, and I'm not going to go through. Next slide. You've got in the deck when you get to it. Yeah, keep going. Next slide. Here's just some more breakout of the points that I've made. I'm not going to go through each of those, but I just wanted you to have some breakout of this in your deck. My apologies, forgot to turn the next slide, please. Next slide. Next. I think there are 3 or 4 of these that I want to skip through. Yeah, I'm not going to go through these. You've got these that further elucidate each of those 5 strategies. Next slide. Next slide. Next slide. I'm going to skip these couple of slides for time. Next as well. Sorry. Okay. The final segment of what I want to do is I want to talk about community and family engagement. And the first thing is just to share with you, here are some of the many, many reasons. You could probably generate another 100 of reasons that you want to engage community and those with lived experience and lived expertise. They understand, and you need to understand, and we all need to understand systemic community challenges that people or external community rarely understand in terms of the depth and nuance to come up with good strategies and intervention. The whole thing about inclusion, and let me say this quickly because it's a point, it is not sufficient when you're talking about inclusion to just invite a few community folks to the table, because the table has been constructed by the power elites to serve their needs and their cultural attitudes about things. When you diversify the composition of people at the table, you need to sit down and jointly co-create what that table needs to look like, what the norms, the standards, and the rules are. And that co-creation needs to not only be how the collaborative operates, but it's about solutions, co-creating solutions that are going to be sustainable. And I'll tell you why. It's very simple. When all of us have gone on to our next job or next project, whether those interventions and strategies maintain and continue to be effective is solely in the hands of residents and stakeholders in that community. So they need to own it. And if we develop it and give it to them, they ain't going to own it. And when we leave, that strategy leaves. Finally, it's also an opportunity to verify the direction that we're going, because people in the community, when they get comfortable, will tell you that's way off. You're going in the wrong direction. It expands the reach of strategies, that people in neighborhoods have knowledge of systems within the neighborhood that many of us who don't live there have no knowledge. So there may be strategies that get generated out of that broader community engagement. And it's building capacity for everybody to do this sort of collaboration over time. Let me jump in. I want to show you 2, next slide, please. Go back up 1, because here's a resource for you, Community Engagement Toolkit. I hardly recommend it. You'll get a link to it. And a couple of the things I'm going to share with you are drawn from that particular tool. Next slide. This is a really important diagram, because one of the things that you as leaders and conveners of a collaborative are going to need to do is you're going to need to be clear and honest about why you're bringing other stakeholders to the table. And I like this because it's a spectrum of different reasons. And I'm not going to go through it all in detail, but I would make this point. You got to be honest with people. If you're only willing to consult people, when you bring people to the table, you tell them this is a consultative process. And you're very clear about what that means and what their decision-making authority and responsibilities are. And it ends with consultation. And if it ends with consultation, whoever's making the decision can take or not take the consultative advice. You need to be clear with people. If you're really trying to defer to community and move to community ownership, which is the demand in a lot of communities, that all you folks have come and gone, and we're not going to participate in any of that stuff up through involvement anymore. We want full collaboration or ownership by the community of what's going on. Again, my point is community's been dealing with people with power forever. They know. All they're asking is, let's be honest. Don't promise me we're going to community ownership when you know at the outset you ain't going there, your funders ain't going there, your leadership, political and otherwise, ain't going there. Don't sell it on the community. Be accurate. As far as we can go right now is to promise you we'll be good consultative partners or whatever it is. This is an important chart. You need to situate where you're willing to go and communicate that expectation clearly to community so they can make a decision about whether or not they want to engage. Next chart, a second one really quickly is it's a good idea to assess existing tables. I like this tool because it's sort of a geographic tool that basically asks you to map out who's at your table and how close are they to the intended beneficiaries of what you're trying to do. How well are they represented? So one of the things I ask people to do when I start working with them is take your steering committee and do this analysis, and then step back and ask why. Where are the holes? What should you be different? How did we get this composition? Why aren't there people with lived experience and expertise at the table? You gotta analyze what you're doing now, and if it ain't right, cop the plea, tell the community, we got this wrong. We don't have the right composition, but we're gonna do better. We're gonna reconstitute this group and help us to figure out who the critical stakeholders are and how to get them. And we're not talking about one person to represent the whole community voice. We're talking about critical mass of people who are outside the normal range of decision makers who come to the table. So again, there's an explanation, there's a workbook in the toolkit, but I really encourage people as a first step, just assess your tables and see and ask yourself, why is that pattern obtaining in the way that in our county or our community we're putting together these tables. Next slide, please. Okay, next slide. I'm sorry. Okay, I'm just going to mention that this is here. There are more detailed questions, but we get a little casual when we decide we're going to embark on trying to do community engagement. And this is a bit of a situation analysis that I'm asking people to do, is to ask yourself, who is being engaged? Who is that community? Who are the families? To get very specific about who it is that you want to engage. You need to be clear on why are you engaging those folks and what is the intended outcome. And to be honest, we're doing this process because the law requires that we do it for X or Y. But just be clear and honest. What outcomes as a result of quality community engagement and participation in the process, what's going to be better as a result of that? So you know what the outcomes are that you're trying to achieve, the outcomes of community engagement, which should be instrumental to your overall population level outcomes. This fourth one is also important. We get a little cavalier. Everybody can do community engagement. Hell no, everybody can't. And some people shouldn't be thrust into a role of trying to lead community engagement because they ain't skilled or suited for it. So you need to ask, who's doing this planning? Who's leading this? Who's supporting the engagement? And does it include people with lived expertise and intended beneficiaries, people who know how to do that work? And finally, I keep coming back to this point. Who's accountable for results? Nothing's going to happen with equity or engagement or any issue if ain't nobody held accountable. If I can do really well and not get recognized or rewarded, if I can do really badly on this and not be identified and put into some corrective action plan. So again, as you go through, you'll find some others. Next slide, keep going, please. I'm not going to go through all of these, but you have at the end of the deck, please go. There are some slides where I sort of summarize opportunities. Let me just summarize one thing. If you're putting together a collaborative and it's new, you've got a unique opportunity. It can be whatever you want to be. You're constituting it de novo. So you really have an opportunity to structure things in a way to begin to address some of what have been historical problems when we tried to bring together cross-sector collaboratives, multi-stakeholder collaboratives. And then you've got a couple of resource slides later on. I'm not going to go through those. Next slide. Yeah, the Collective Impact Forum is where I work, and they've got some great resources online. This is one of the most powerful resources I know around collaboration, community change. It's free, University of Kansas Community Toolbox. Regardless of the form of social change you're trying to effectuate, you will find tools and articles and information and resources in this document. Okay, let me conclude. And I'm sorry, I'm not too bad. Let me conclude by saying something about prevention. It's really encouraging to see so many efforts, including yours, where people have made a commitment to going upstream, right? To get out of the reactive remedial mode and go upstream. And there's a lot of reasons for that. One reason is that we ain't good at remediation, right? We're horrible at remediation. I give you the criminal justice system where we've got a 70% failure rate in terms of trying to remediate behavior. So we need to put our marbles into the basket of prevention and upstream, because we're much better at that than we give ourselves credit for. We just don't listen to the data and the wisdom about what to do upstream that'll produce better outcomes. So since 1966, we've known that Head Start programs have dramatic benefits for kids who are enrolled in them and their families. The families do better in terms of employment and economics, and we've known that since 1960s, and we've never fully funded early childhood education, especially Head Start in this country. So we've got to not only change our mindset around prevention, but we need to have our dollars and our priorities flow with that. Let me make one final point. You know, I used to use the metaphor that, you know, we're oftentimes find ourselves discovering that there are babies floating down the river, and we go and we mount an effort and we start pulling the babies out of the water. And at first, prevention meant, well, maybe we should send somebody upstream and find out who the hell is dropping these babies into the water. Why are these babies here? And that's an important step, and I think you're doing that. But I want to suggest to you it's more fundamental and structural than that, which is it's not sufficient to frame prevention as simply moving upstream. It needs to move upstream to some basic structural defects that we've let persist in this society for far too long. Part of prevention and real prevention around all of these myriad social problems that we're trying to deal with is embedded in how we fundamentally structure the society to provide for its people. It is things like guaranteed basic income. People shouldn't be struggling to have enough money to meet their basic needs. It should be a sustainable wage, right? Not $15. The fact that we're having a $15 conversation is absolutely abhorrent. Where in this country, in California, can you live on $15 an hour? When you prorate that out, it won't cover a one-bedroom apartment in most cities. That's stupid. We're creating a structural problem that disadvantages people, that causes them to have adverse experiences, which produce the kind of things that we're trying to prevent. Universal health care. The fact that we're the only industrialized leading economic power in the world that doesn't guarantee health care, including dental and mental health. And we need to do that. Quality, safe, affordable housing, nutritious food, quality education and training. My point is that we need to have a conversation not only about adapting upstream, but talking about structurally and fundamentally, what do we want to guarantee people in the society and work for? And You know, I'm not arguing socialist. I'm a capitalist at heart, but I'm a, a, a capitalist who knows that good capitalists know their most important sort of asset is the human beings that we work with. And if you don't take care of them, capitalism is going to fall, and we ain't taking care of kids and families. We're losing the intellectual the intellectual talents of so many groups of people. So my point is, I implore you, go upstream, but go up with a vengeance and get to the structural things, because we don't need to be having so many kids, so many families in all these downstream bad situations. We can do better. We have to do better. And in fact, our survival is dependent upon us doing better and reducing the number of kids come in with abuse and neglect, the number of people we send to incarceration. I can go down the whole line of things. We got to do better on all of that, or it's a drag on the progress within the society. So by all means, we need to reimagine prevention, but we need to reimagine prevention as doing some fundamental things that take care of children, of families, of neighborhoods, of communities. So no matter what the problem is, there are fewer and fewer people getting to these critical stages that need intervention. And I will conclude by saying intervention that's 10 to 20 times the cost of the upstream stuff that we can do. So we're making foolish economic and budgetary decisions on top of what I consider to be immoral decisions when we decide that we ain't going to take care of all of our people. Thanks for your time, and I'll turn the mic back over to
Michael.
I think it's my turn again.
Can I just mention something very quickly? I know a lot of participants were asking about the PowerPoint. It has been uploaded to the chat, so if you scroll down, we'll do it one more time before the webinar is over. You will also get it in a follow-up email, so you will have all of the slides that Junius shared, and so that will have all of the information. So now I'll pass it along to Michael, who will do a moderated conversation with Junius.
Yeah, great. The thing about the chat is there are so much applause and hearts and thank yous and amens that it's hard to land on anything, which is just a testament to what we knew would be the value of having Junius here to set the tone in our Reimagining Prevention series. If you scroll back in chat, there's also chances to link on to the CalTrin trainings that are related. We're going to bring Junius back to dig into some of the community engagement tools at a more practical level, because we know there's so much, and we know that that we needed to see even briefly all of those slides just to know that there's so much more to dig into. So this is the section where I know our planning committee, I didn't get to be at all those meetings, but just really, Junius, I know, enjoyed like just doing the planning with you and the conversations that went to. And we thought a conversation is what we all could use, and to hear off the cuff and from your thought and heart, some examples and ideas. So I think Hillary, being our chief of the Office of Child Abuse Prevention, I think has the first couple questions, which are a little more policy related. I have a couple practice related ones if we get to those, but why don't you take it, Hillary?
All right, thanks, Michael. And it's getting a little hot in here. I feel this fire under me, and I need to get moving right now. So Junius, thank you so much for your words. I heard a lot of different themes that aligned with the vision of OCAP. So that was fantastic to know that we're at least thinking the right way, but now we have to start moving in that direction, and we need to do it all together. So I'm going to start with the first question for Junius. When we think about reimagining prevention, specifically child abuse prevention, how do you imagine community voice and equity as the foundation?
I imagine it procedurally, because what that sparked in my mind is, how do you get started when you want to embed the prevention element into a community process? Let me suggest this. The first thing I would do is I would understand who it is that I'm thinking about engaging at the table, right? What subgroups or populations or demographic characteristics, however you're doing your community. And then what I would probably want to do is say, okay, who are some individuals who represent those groups who have been at tables with us in the past, right? And I would identify some key informants. And then I would go out and I'd be really honest with them. We want to do better in terms of how we're engaging community voices, how we're doing equity. What's been your experience in trying to work with us in a collaborative way? And how would you suggest we approach this? I wouldn't just go off and plan again. I would do some outreach and I would admit it. I'd say, we don't think we've done a very good job. They'll probably agree with you. I know when I do that, most of the time people say, yeah, you've done a lousy job. So, but get over that, because the overture that you're asking them and you want to be informed, this is a whole way that we're talking about, like lived expertise and experience. Well, let's use it. Let's go and say, how did we do? What did we do poorly? Who else should I talk to? Who might be some people that we would bring to the table? You get people who are in various stakeholder groups aware of what you're doing, because that starts a vibe going that people say, hey, social services is forming some new group. It's a little strange because they didn't start by doing a table with a 2 o'clock meeting. Somebody called me and asked for coffee, or, people pick up on that, because part of what you're probably doing is repairing past problems around community engagement. And you want to listen to that and use that to figure out how to do it better the next time. So that's the way that I start. And once I've got that sort of kitchen cabinet together, they're going to help to guide us. They're going to help to figure out what some of the potholes are. The final point I would make is, for each of those stakeholder groups, who's trusted in that stakeholder group community, that if I get their support, it's going to help to move the agenda. And I'd be really adamant about having the engagement and developing the support of those people, because some of them can make a call and cut out 5 months of work by just saying, okay, we think we should help do this. So let me stop there.
Thank you so much for that. And what I heard was community engagement needs to be number 1 instead of number 3 or 4. And we need to start there. So that would be one way that we can start making changes as we're developing our policy and our programs. Yeah. Thank you for that. Our next question is, what does it look like to truly center our collective efforts in equity? In the case of child welfare, behavioral health, probation, and other child and family organizations, how can parent and caregivers' voices be held as central to the work?
Well, there are a couple of different things. One is the composition of your groups. That and this goes to the single voice issue as well, that you really have to guard against. One person cannot represent the diversity of community interests. And plus you isolate them and you communicate that the power elite still have all the control. One of the things I've been trying to do more recently in my work is to convince people, make the committee a majority of residents and other stakeholders. So people come in and say, well, now I also try to, that if we vote, there are 13 of us and 3 of the other folks, sends a pretty powerful message if we end up voting. Now, what I do immediately is to say a better model of decision making is consensus building, because you got you with lived experience and lived expertise, and you got these folks with lived experience and learned expertise and stuff. We got to meld those two things together. And so a consensus decision-making process is one that we want to do to get the best of everyone's thinking. But you see where I'm going with this is that you need to communicate that something's going to be different. And if they come into the room and like always, there are a couple of random residents and everybody else is a bureaucrat, a power elite, and that we're going to produce the same results. So that's the first thing. The structure helps you center. You probably saw the example that was in the article if you were able to read it. And I'm blanking on the name of the San Francisco program with Dr. Zia Malawa. It'll come back to me. But anyway, what they do is that before they get into their decision-making process, the final word before voting has to come from the mothers. So from the residents around the table, they always get the last word before people go, to just reinforce folks about this is what people with the most direct experience, these moms, have to say about this issue. How do you want to weigh that in your calculus of decision making? So that's a particular technique. But as I said, what I'm trying to do in mine is to get everybody comfortable with, if you're going to center equity, as I started with, you need to know who are the populations in your community, the subpopulations, and who's experienced what kind of disparities, and to make sure that you have that list, that I'm going to do an analysis to say, if I'm going to do an intervention or I'm going to do something, and I know that Black folks and Latinx people and LGBTQ people all are experiencing disparities, I'm going to center in a conversation with people from those groups, what's your analysis? What's your strategy? What is piquing your interest in this, right? That's how you center. You have a line of inquiry that's specifically around how is this going to impact a particular group. So the broader frame, the macro, is you're going to center equity. The micro of it is who's experiencing disparities, and let's go through and systematically talk about what a strategy and intervention and action might mean to each of those groups to minimize unintended consequence. And oftentimes we can find a basis for mitigating a potential impact if we know there. So that's what we're doing. We're putting into our decision-making process some steps by which we step back and are asked, who's likely to be negatively impacted? What are ways to mitigate that? What are strategies that members of that group experiencing a disparity would suggest to us?
Wow. I'm just hearing listen, and definitely we have to maybe even possibly have some sort of public forums or listening tours of some way to have a better idea of what is happening in the communities and making sure that those voices are heard. Mm-hmm. With that, I'm going to pass it to Michael to ask the next question.
Well, I think part of the wow is, thank you, Junius, that you, like, I'm looking at our upcoming questions and your answers are so full and complete that you almost answer them all at once. But I think it really is helpful, I think, for us to look at this, the angles on this. And we have this, I'm going to reframe this question maybe a little bit to build on what you're saying, because I also heard the decision-making process and centering the voices and really giving space for the voices. But the way this is framed is, let's talk about power sharing. What are optimal strategies for elevating marginalized voices in the community and sharing power in decision-making without it being performative? And I'm going to expand on that a little bit in that, especially those of us who are in the social service field, or we're trying to do planning at the county level, what do we get wrong that makes it performative? And how can we make sure, and what do people maybe avoid that makes it performative? And what are some strategies around that?
That's a really good question. I recently was working on a project, and I alluded to this before, where I was able to convince the funders and the government folks at the table who were leading the work to make a majority of the planning team that was going to shepherd this wealth building work for residents of public housing sites, right? And we got that. And then the first round, we brought a majority of people. There were three organizations represented at the table, so we brought in 5 residents, so they had the majority. As the work expanded, we decided we didn't have enough, so we brought in another 8, so we had 13. What happened, though, is that, and I blame myself for this as well, is we had to goes back to stopping everything going on and saying, what is the culture now that we're reconstituted need to look like? What are we building out? And this has been really trying, and some folks at the table are really frustrated with the residents. The first thing the resident said is the governance body for this doesn't have a single resident, so decisions get delivered to us that are bureaucratic decisions from the city, the national intermediary, and the foundation, and ain't none of us at that table. So what they did is to start challenging to say, if we're really going to share power, every table at which matters pertaining to this initiative are discussed, we should have resident representation there. So you see where that's going. We've had to kind of restructure not only the immediate table that we're at, and it's brought up some rough stuff. The city has been promising for 10 years to do resident engagement and resident councils, and they don't exist. So we've gotten drawn into all of the lack of attention to resident participation that the city has visited up on the process. So what are we doing now? We have to go through and restructure the whole process. One of the things we found out is that they had better, there are things like meeting alone. Is it okay for the residents to sort of meet alone as a group? And I'm a kid of the 60s and was really schooled in that. Part of what we did around power building back in the 60s is every racial and ethnic and interest group met on their own, and then we all came together and everybody was comfortable. I can't tell you as a black person what black people need until we figured that out. So I can't come with Latinos and ally or coalesce with them if we're not clear on our agenda. So that's a regular part. So my thing was, of course, let them meet on their own without any of the rest of us there, which is both an acknowledgement that that's okay for people to kind of get their act together who are at a different place. So again, those are some of the ways. The big issue, I will say this, that is a test is who's making the decisions about the strategies, interventions, and programs, and does that reside with this body, and who's making decisions about the use of whatever money has been allocated. Those are 2 litmus tests for me to be able to figure out whether or not we're moving towards something that's really owned by residents.
I think this one's yours, Hillary.
Okay. All right. Junius, I feel like you've answered all of our questions in some ways, but I'm going to go ahead and move on through them. What are some of the challenges you've encountered with creating equitable community engagement, and what strategies would help organizations overcome them? And we have a lot of community-based providers here, so they're doing that ground level work. So if you have strategies that are specific to that, I think that would be fantastic.
Well, one of the things that I'm doing now that's occupying a week is that either we have unpaid tables or we have paid tables. That it is not, it's not acceptable for all the bureaucrats and power brokers to be there. You can meet once, you can meet 100 times. I'm on salary, I don't care, right? Versus residents and other people, we say that their expertise ain't valued, their experience ain't valued, so we expect them to come to the table without being paid. My new thing is I want everybody at the table to be paid. Do we really? because that's how we indicate to people that we value what they're doing. I'm a consultant. That's my life stream, is that people value what I'm presenting and therefore they pay for it. Why are we abandoning that principle and have all of these other people paid by nonprofits or public agencies or foundations, and we expect the people with the least amount of resources to be at the damn table for free? That is unfair. It's communicating something that we don't want to. So that's what I've been trying to do with varying levels of success. Sometimes it's a little stipend. I've gotten one where we're paying consultant rates at $75 an hour. My thing is that we at least need to be at a sustainable wage for 2 families in what we're paying people, which in the Bay Area would be about $40, right? $19.95 for one. So that's sort of the frame. So that's one of the things I'm doing, is trying to help to create a playing field that respects everybody's skills and talents that are coming to the table. A second thing has to do with leadership structure. I prefer leadership structures where every work group and everybody that's created under the collaborative is a co-chair, right? Is a co-work group leader, is a co. So it gives me an opportunity to bring someone who's traditionally been involved in that and residents, so that they can build their skills and capacity, exercise leadership. Another thing that Dr. Malawa is doing that I really love and haven't been able to do it, but she assigns one of the traditional leaders and one of the community folks, her mothers, in her program as partners, and assigns them to get to know it. That as a leader of health and human services in San Francisco, you maybe want to know at least one Tongan mother who's pregnant, right? Because you're making policy for every birthing person in the whole city, and you ain't in relationship with no Black or brown or Tongan or Pacific Island folks. So she matches folks like that and expects them to spend time. By the same token, many of the mothers have never met somebody who's heads a big foundation or a big agency. So it helps them to gain experience and comfort in talking with those people, and it adds someone to their network. These experiences should help the residents to build their skill sets and networks. So I know I've gone on. Those are things that I would suggest are part of getting to community engagement that's equitable and is going to set a platform for you doing the good work that you want to do.
All right. Well, thank you, Junius. We need to make a strong effort to make sure that folks are feeling valued and appreciated, so they know that their voice matters and they're not just there at the table. We actually are listening to what they have to say. So I appreciate everything that you've shared today. And I know the audience has some questions for us. So I'm going to pass it over to Lydia, who is going to ask some of the questions that we have seen in our Q&A box.
So again, I just want to remind everyone to please use the Q&A chat box. There's a lot of comments in the regular chat, so we will not be able to sift through that and find the questions that you have. So again, please use the Q&A icon. It works just like the chat box, and enter your question in. So Junius, there's actually quite a few questions around what is the best way to create accountability, how to structure that, and also I think, how do you develop data for accountability? So I'm not sure what you want to tackle first. Maybe what is the best way to create accountability for those at the table?
Well, the accountability structure is on 2 levels. One is accountability for the role that various stakeholders play in the collaborative, right? And there should be job descriptions to say this is what a co-chair of the steering committee is responsible for doing, right? So that there's a clear job description, that there is a structure by which there is at least an annual evaluation of how people are doing in that role, along with feedback on how they can improve that. So that's some of the foundational pieces of setting a system of accountability. People have to know their job. There has to be some performance review and some structure and opportunity for people to develop and build their skills and capacity. A second point of this, and this is a deep structural issue, and we've done this in several different areas that are touchy about. We did this in community policing. We're doing it now with respect to equity, and that is the reward and punishment systems are not aligned with people doing this work well, right? I can be an outstanding community police person, and if I'm not on the SWAT or the tactical squad or the drug enforcement, those are the routes for upward mobility in a police department. So what happens is the best cops don't want to do community policing because there's no rewards in it. There's also no punishment if you do it poorly. So I don't want to replicate that in the equity frame. What I want people to do is to create systems that say, if you do this good work in our organizations, we value that, and it creates upward mobility within our organization because we're going to reward it in evaluation and compensation and upward mobility within the organization. The final thing that I would say, this collective accountability is the hardest thing in the world to create, because you have to create an underlying culture that we all own everything that happens here, and that if we're not performing the way that we should collectively, it ain't for me to turn to Michael and say, well, Michael, you were responsible for that and it ain't getting done. It's my say, Michael, we didn't get that done. What can we all do to help accomplish that objective or outcome? And it builds into a culture that we're regularly doing performance evaluation. We're regularly figuring out how to support people, and rewards for accomplishments are distributed across all of the stakeholders, right? It's shared credit for our accomplishment, and it's shared responsibility. Y'all work in groups and organizations. Creating a culture for that is one of the most difficult things, I think, that we've attempted to do, but I think we can start making some inroads if we have the right structure, which is, what are our performance evaluation systems of the collaborative work look like that are really stressing the development of those skills, and what are individual organizations doing around evaluation of people's participation and behavior in collaboratives, and how are they rewarding or supporting improvement there. So those are some things that I would suggest are at least lines of inquiry to pursue around how you create it. But as I said, all of us know who says that. I can't remember who the author is, that culture eats strategy for breakfast, right? And it's really true. Culture and these things are really powerful. So reculturing a collaborative is difficult. But go back to the point I made. The opportunity, if you're creating a new collaborative, is to think deliberately about what do we do to create the kind of culture that we want, because we've got a blank slate. We're bringing people to this collaborative table for the first time, and we've got the opportunity to set the norms for the group, right? And to really try to embed in some of these norms around collective responsibility and accountability.
Great. Thank you so much, Junius. Those are great points. There is another question, actually a couple, but I think it's pretty much asking the same thing. It's, how do we providers collect data in a way that's not contributing to a harmful power dynamic? I mean, I think also it could just be asked about, like, you know, how do we create data that's not creating harm to the communities we're serving?
Well, one of the things that I think increasingly people are figuring out they need to do is, you need a data governance group, and you need to get the right people at the table, and you need to have an infrastructure for data governance. that is going to help you address some of the issues. And let me say a couple things. One of the problems in a lot of this and the way that we've dealt with data in these systems is we've collected data on participants and have walked away with, we own the data, we decided what was going to be collected, we decided how it's going to be used. I think part of what we need to move to is ownership and control of the data, first of all by the individual to say yes or no that you can use that data. A corollary of that is we're not structuring the data so that it's all beneficial to the people we're collecting the data about, and that's something that we should correct. If I'm pulling together all of this data and information on somebody, might I think about what roadblocks do families have around being able to readily access critical documents that they need? Well, we're not building out systems where I got my iPhone and my electronic wallet and I can store my documents there, and all of the COVID mess, I just grab stuff from there. What are we doing for low income people? So I would make the point around, are we at all thinking about, can we both address our need to have data and the needs that community people might have for documents and data, so that we develop a system that addresses both. The broader issue, though, is you need a data governance structure, and you need to think about disabusing yourselves that the agencies own the data. The people own all publicly collected data. Any bureaucrat is merely a custodian of that data, and they do have a fiduciary obligation around the management of that data, but it's like my brokerage account. My broker has a fiduciary obligation, but he don't own my assets in that portfolio. And it's the same with data. So that's something that's really important. Pulling together a data governance structure that is going to make sure we get the best available data, but that people have access to that sort of data and control over their own. And the best way to do that is putting together a data governance body that builds the confidence of both the bureaucrats that the data aren't going to be misused or violate confidentiality or privacy laws, and that families and individuals know that people are going to protect their confidentiality. And I keep saying, and provide a tool that gives the family something that's beneficial to them, to have like all of the school records in a wallet or something, someplace to download. Other things that we could easily do to enrich the lives and help families, that when we get them to the table and say, what are your needs, before we design how we're going to do the systems.
Great. So we have time for one more question. And so I'm going to ask about, the backbone organization and some of these steering committees. How do you address where the responsibility lies, whether it be in funding or whether it just be in, who's going to lead that effort? And then also, how do you deal with opposition? So people that are opposed to collaboration. And we've talked, I think this is a common theme that we're starting to hear is, de-siloing. And I went to a conference recently, someone said, let's stop talking about it and let's just start doing it. But just your thoughts on that, like on responsibility of the backbone of a committee or stakeholder collaboration, and then if there's opposition to collaborating with other organizations.
Yeah. So let me make a general point, both about the backbone and about more broadly the collaborative infrastructure. I caution people, don't make irreversible decisions on structure and on backbone too early in the process. It won't serve you well. So for example, one of the most critical decisions that's going to be made is the initial backbone. When you're in the very early stages of the collaborative, somebody's got to start doing backbone stuff. You want to have meetings. You want to start building a little bit of an infrastructure. So part of what people have a tendency to do is to let's go ahead and find somebody who can do the backbone role, select them, get them on board. And a couple problems happen. People with standing capacity to do this typically are white organizations, oftentimes with not a lot of representation of diverse populations within the community. So oftentimes a funder or somebody who knows that organization pulls them in and say, you be the backbone. The first thing is you've selected a critical ingredient to this recipe, and you haven't asked people about that. So my thing is to say, don't feel compelled to get all of this structure. I put interim on everything. Here's interim backbone. Once we get to the table and get organized, we'll figure out and do a process to do a permanent, a relatively permanent one. We've got a temporary steering committee that we've only got together temporarily till we get everybody at the table kind of immersed in what we're doing, and we'll figure out what the best composition, structure, and size of a steering committee is. So it's those sorts of things that are really important early on, not to lock yourselves in. A quick story on it. When the Opportunity Youth Initiative at Aspen came to my old organization, they had gone through a year-long process that I was totally unaware of to select my organization to be the backbone for an effort in Oakland and Alameda County. I knew better. They came in and say that, and the first thing I said, I need to go back to my collaborative and ask permission, right? So I did exactly that because I don't want to have to live with somebody else's decision, because I got to live and work with those people who are around my collaborative table. So I went to the collaborative, said, this is what's happened. I had nothing to do with it. I didn't even know going on. Here's the letter of invite. What do you want to do? You can tell them that you're going to decide on who the backbone is, or that you don't want to be involved. They said, okay, we trust you. Let's go through the first phase of the application process. We did that. We won an award, and then we reopened it. Say, okay, now we got the grant. We want to reopen the discussion about who's going to be the backbone. And again, we got an endorsement, but we didn't let external people and we didn't let our organization decide that for people. And that's really important because people trust us now that we're going to manage for the collective good and not for my organization's good.
Great. Thank you so much, Junius.
There was one other question, let me say. I saw the question about number and steering committee. Somebody's talking about 18. I think you got the right instincts. You got to balance composition and diversity with having an unruly size group. And that's why about 18 is probably as large as you want to go. But you can have innumerable work groups, committees, or whatever, all of which have a co-chair, so it creates leadership. And the other thing is you want most of the decision making to be down there. The steering committee should be brokering and aligning and doing that stuff as opposed to on top of the specifics there. So let me just stop there. I see we're almost out of time. Sorry. Let me throw it back to Michael.
And I think I'm going to throw it over to Jennifer Rolls-Roots, our partner at CalTrin.
Actually, we're going to go to Jessica Matley.
Oh, Jessica at CalTrin, sorry.
Nobody wants to end this, huh?
Got a couple little bits of housekeeping first. What's next?
That's right. So hi, everyone. My name is Jessica Matley. I'm a training coordinator and facilitator with the California Training Institute, but you might know us as CalTrin. We're funded by the state of California, Department of Social Services, and OCAP to support child abuse prevention through professional development, training, and extended learning to family resource centers and CAPCs in California. So I'm here to really talk about the next steps, the what now, if you will. And really, what does the roadmap look like going out from here? On the screen, on actually the next slide, you should be able to see there are a couple of domains, a couple of topic areas that'll be covered over the next couple of months as we roll out and continue this path of reimagining prevention with equity and community voice at the foundation. So some of the trainings will be held as a standalone event. Maybe it's a webinar, maybe it's a meeting, while others might include a follow-up workshop, planning sessions, small group work, and really it varies depending on the topic and how deep we dive into it. Some of the things I want to highlight on here, we have shared vision. You can see that development with Haywood Burns. We have the comprehensive plan overview with OCAP. CalTrin will be leading a 3-part change management series where we'll be talking about exploring prevention mindset, taking action and cultivating commitment to a prevention mindset, and finally leading through change and shifting towards a prevention mindset. And as you can see, there are several amazing topics on here, including the community engagement tool that we talked about today. So let me tell you where you can get this information on the next slide. Where do you go? It'll all be housed for you in one central area. So you can see that website on that first little link. That's the Strategies TA website. And on their events page, you'll be able to see all of the registration links, the information coming up for future events. But we'll make it easy and we'll come to you if you're signed up for the Strategies TA newsletter or CalTrin newsletter. The information and dates will actually be pushed right into your email inbox. So you can do that as well. And of course, if you should have any questions, you can always reach out to us. There's some email options there for you, and we're happy to assist. So with that, I will send it back to Lydia and say we're looking forward to being on this journey with you.
Great. Thank you so much, Jess. I wanted to bring your attention to a few things. One, we have an upcoming event with the Haywood Burns Institute, an introduction to structural well-being, which is going to be a really, I think, amazing webinar that will talk about their structural well-being work, as well as a framework that they use to really help empower families and community members in living their best, healthiest life. So that will be March 15th from 1 to 2:30. We are dropping the registration link in the chat. So please go ahead and sign up for that as soon as you can. And then also we will send the link again if you're not able to do that in the follow-up newsletter. So you will get a follow-up newsletter from us that will have the link to this recording, which will be on our YouTube channel. So you'll get a YouTube link. You'll also get just a brief summary of what the webinar was about in case you wanted to share this with other folks that are passionate about this work. And we will also share all of the links and websites that were shared today, including CalTrin, so that you can check out what they have to offer, and also CDSS, OCAP's resources as well. As always, please follow us on YouTube, LinkedIn, and Facebook to keep in touch. And also, please visit strategyca.org for more information about events in this series, as well as signing up for our newsletter so that you can be apprised of what is happening. So again, we just want to thank you all for joining us today. It was such an amazing day. We learned so much from Junius, so we want to just give him another virtual round of applause. And, you know, just for sharing his experience, his expertise, and his thoughts. Hopefully we can all go forward and start to really think about creating an equitable system for all, and hopefully a reduction in child abuse and neglect. So thank you again, and we'll hopefully see you again in March.